My name is Antonia Chen. I'm an associate professor at Harvard Medical School and director of arthroplasty research at Brigham and Women's Hospital. You are listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Antonia Chen, orthopedic surgeon at Harvard. Doc, how are we doing today?
Doing great. Glad to be here. Thanks for inviting me.
Thank you for being with us. So getting started, what were your goals and aspirations during your residency, and how have those changed throughout your fellowship?
So my goals of residency were to survive. I wanted to finish residency, get out with my hair on my head and my skin on my body and just get out of residency and be done. But residency was an amazing time. I learned a lot. You sacrifice a lot of sleep, sacrifice a lot of things, but you really test your limits and you come out alive and feeling like you've done a lot after that. So residency was to get through, learn as much as possible, but residency was a time that you're exposed to everything. Fellowships where you fine tune everything. So fellowship, I wanted to get really good surgically. So I want to make sure that I knew my hips and knee replacements well, felt comfortable taking trauma and felt comfortable doing things on my own. So fellowship was independence. Residency was building camaraderie around my residents, experiencing as much as possible, and then making decisions from there.
So kind of taking us through your fellowship year, what was your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
So getting a job is always the hardest part. A lot of my fellows that year came in with jobs at that time frame, and I did not have a job. I started looking for a job when I was in fellowship. So that was a little bit stressful, I have to admit. Trying to schedule an interview when you don't want to make your attending upset is always hard. So my attending went away on vacation for a week and I scheduled 5 interviews during that week. So, and you can't help that. It's one of those things that you try to do. I didn't do that till January though of my fellowship year, which felt pretty late actually. Now I know that people who are going through COVID now, unfortunately, I've experienced the late delay in getting a job as well, but I didn't do it till January. I didn't sign a contract till March. And again, that felt late compared to everyone else. So the first job search was interesting. I have to admit, I did not expect to go into academics initially, but after enjoying academics in residency and when I was in fellowship, I felt that I wanted to enjoy the world of academics. But I looked at different areas. I looked at academics and I looked at private practice, and I felt that the academics probably fit me best. So I looked at different academic groups and saw what I could get, how I could fit in or what they needed, right? Because you don't want to join a practice where they don't need you. That's an important thing. And two, how can they contribute? How can you contribute and how can they help you grow? So ultimately, I was at a fellowship at Rothman Institute and I ended up staying there because they had a robust research program, but they wanted someone to help grow it even more, or help support Dr. Parvizi. And that was a great role for me to be in as a starting attending. So I could learn a lot about research through him, conduct research on my own, and be clinically active as well. So that's how I eventually settled at the Rothman Institute for my first job.
And now after that, you made another transition. Can you talk about what that was like for you?
So everyone starts their first job, and I thought I was going to stay there forever. Very few people leave Rothman Institute. I saw the statistic that 50% of people leave their first job within their first 3 years, and I'm like, I'll never be a statistic. And I became a statistic. And my reasoning was is I was learning a lot from running how to do run research, and it was great. And Jim Kang was one of my residency mentors. All of us have a lot of different residency mentors. He was a spine surgeon. And he came over to Brigham and Women's to become chair. And when he was chair, he's like, I really need to build up my arthroplasty research. So he knew that I did a lot of research. So he reached out to me and said, are you interested in running your own arthroplasty research here? So it was a really cool opportunity to take what I'd learned for the last 3.5 years and then apply it to a new setting where I would be in charge. So I was, debating whether or not it was too early or not to do so. But he reassured me that there would be a good opportunity. And then at Rothman, they also reassured me to say, you know what, it's a good opportunity. You should take it. So then I went ahead and changed jobs. So I became a statistic, but it was a move that was supported by all, which was nice.
So what would you say were some of the keys to your success starting out to get you to the point where you are today?
It's interesting to look back at this now. A lot of things that we all know about when it comes to orthopedics or life in general is hard work. We just do a lot of hard work and keep your nose to the ground and do a good job. But in all honesty, that's not always enough. A few things made a difference. One, don't make people upset. I'm here because Jim Kang was my mentor back in residency. And thankfully, hopefully didn't really upset him too much, so that he was enough to trust me and to take me on as a faculty here at Brigham and Women's. So don't burn bridges along the way is number one. Two is networking. Networking is really key. The more the people that you get to know, the more that you get to interact with other people. It's not just a matter of networking for the sake of, going up the chain or anything like that. It's network because you genuinely like these people. And when they think of you, they're like, oh, I really like working with X, Y, and Z. Then they think of you and kind of bring you in. Again, I was a resident at Pitt, and Jim Kang was like, well, I think you're a pretty good resident. Why don't you, come aboard? Or when I was a fellow, they clearly liked me as a fellow, so they say, why don't you stay on board and be faculty here? And they weren't necessarily looking for a new hire or a new attending at that time. So networking, connecting with people, doing a good job are all key to what you do. And then three is probably say is find your passion. Find what you like to do, find what you're good at and stick to it. It's none of those things where I realized that I like research and I think I'm good at conducting research. So I went on the research path. If I said, I want to be a, business person and I want to run the business, while I have an MBA, that wasn't my pure focus at that time. My goal was to do research. So know your passion, know your focus, and capitalize on that when doing your job or running or finding your job too.
So as an emerging female leader in the space, what type of obstacles have you encountered personally that's gone through your journey so far? And what type of advice do you have to give back to the female population that are looking to get into a surgical specialty?
So for all you women out there who are interested in orthopedics, all I say is do it. It's fantastic. It's what I love to do. And it's one of those things where I actually never thought of when I was younger. So my sister tore her ACL and I'm older. So she had a VHS of her ACL reconstruction. She brought it home. She goes, do you want to watch it? And I go, absolutely not. I had no interest in surgery at all whatsoever. I thought I was going to be a pediatrician. So then when I was in medical school as a first year, I was doing anatomy and I thought the anatomy of the musculoskeletal system was fantastic. And I was like, that's a really cool thing to do. We had an orthopedic surgeon walk us through the anatomy of the hand. And he was very passionate about what he did. And I thought it was great. So one of those things is don't let it deter you if there's not a lot of men or not a lot of women or a lot of people who look like you in the same field. Because if you love it, then it's going to come and show out. So like when I do my cases, I love hip and knee replacements. I love how my patients do, and that's a key factor. Two, we have a big role as women, I would say. So I have female and male patients who specifically said, I sought you out because you're a woman. I'm not quite sure what that means, but at the same time, it was beneficial. It's one of those things where I'm like, well, there's actually not many women who do hip and knee replacements in the United States. So I'm glad that you found me. So for women out there, you say we do fill a niche a niche role where, some patients really do search that out. And then the other part too, I would say, is that we add diversity, and not in the sake of just naming diversity, but we add diversity of thought to things, right? So for example, one of my colleagues, she was breastfeeding and they're like, and she had the pump and they're like, well, where's the pumping room? And then no one knew. So they had to create that. Right. And it was one of those things where the nurses then came up to her afterwards and were like, thank you for doing that. We need that as well too. So it just adds a diversity of thought, something, the male colleagues weren't against having a breastfeeding or a pumping room. They just didn't think about it because they didn't have to do it. So it just gave us a different thought. So we can add perspective to it and a different viewpoint of things. And this is true for a diversity of all things, right? It's not just diversity of gender. It's not just diversity of race. It's diversity of background, diversity of location, and all sorts of things. So everyone sees the world differently, and that's a good thing. And so we can contribute to the world in a different way. So
with your involvement with residents and fellows, what type of advice do you have for them when they're entering the professional job market for the first time?
The most important thing, I think, is to feel comfortable in your own skin. And it's hard to do that initially. Now, it's scary if you feel comfortable right off the bat because we don't know what we're doing when we first start. So the first thing I would say is if you feel uncomfortable, ask for help. Ask for help from your residency mentors, from your fellowship mentors, from your partners, because it's okay to ask for help. The second thing I would say that was new to me when I was starting as attending is that for the first up to 1 year, for me it was about 6 months, you're going to be sleepless the night before your cases. And no one told me that. I was able to sleep like a baby throughout residency and fellowship, probably because it wasn't my cases. And we were so sleep deprived, you can sleep standing up. All of a sudden as an attending, I'm like, I'm going to get a good 8 hours of sleep. I'm going to be ready for my cases. And all of a sudden I couldn't fall asleep. And it's because I was just churning through the steps of the cases. And it can be a primary case, a very straightforward case, but all these little decisions are yours now. So don't get caught up in it too much. You don't want to be bogged down by it and paralyzed by it, but at the same time, recognize that it's actually important to walk through all the steps, feel comfortable with it, and get more and more comfortable in your own skin. You've seen, a total hip, for example, 10 different ways or even more. Which ones are you going to take with you? What are you going to use? What are you going to change? What are you going to choose? And that's okay to develop that regimen over time. You don't have to walk in saying, I have to do this, this, and this, and then stick to it. You'll find what works for you and utilize that in practice.
Now, also with your involvement with the residents, what do you think that they're looking for as far as medical students applying for residency spots and also residents applying for fellowship spots?
So for medical students applying to residency, unfortunately, step one is still a factor, although after this year it won't be a factor because it's pass fail. In orthopedics, most of the places don't necessarily look at your score. They want to make sure that you're well-rounded. What does well-rounded mean? Well, you don't want to have like 85,000 publications and then have a terrible score, or a million publications and then all passes in your classes, right? So you want to do well in your classes. I always look at surgery because I think that's reflective of your time and how you interact with other surgeons and how much you care about surgery. And I'm talking about general surgery, not necessarily orthopedics as a rotation. Your letters of recommendation mean a lot. You want to get to know people well. You don't want a generic letter of recommendation that says, Bob Jones is a nice person and works pretty well in the operating room, right? You want someone to know you really well and be stellar, which means you don't have to get the most prominent person to write you a letter. You want to get a person who really knows you to write a letter. And the final thing when it does come to research, says I do tell medical students, you do want to do some research, but it doesn't have to be in the field that you end up in. So for example, as an intern, you might think you're going to do cardiology. And so you did some cardiology research. That's okay. I just want to make sure that you actually able to get it over the finish line. Do you have a presentation? Do you have a poster? Do you have an abstract? Do you have a paper to show that you actually are able to take a concept and take it across the finish line? So it doesn't have to be in the same field, but I'd rather you finish it as opposed to just leaving it in the breeze and having 15 open projects, but nothing over the finish line, because we like finishers. That's a big thing. When you go from residency to fellowship, the ballgame totally changes, right? It's not about how many publications you have per se. It's not about your scores, or because there's, besides your USMLE scores and your board scores, which don't come out till later, the only thing that really matters is your connections. So who you know makes a difference, who can vouch for you. Because when it comes to fellowship, when I'm working with a fellow, you're one-on-one for a full year. You're basically working with a future colleague. So you want someone who you actually like, and you want to be liked by them as well too, because these are the people you can call for anything. I mean, call for any advice, any problems. And again, we're colleagues after this. So for fellowship, get to know as many people as possible when you're a resident, when you're applying, and your letters of recommendation have to be really strong, because that's what happens. If I write a letter of recommendation for a resident, I'll get a phone call and they'll say, well, what do you really think about this person? And then on the same flip side, I can call to other people and say, hey, I'm going to advocate for this person or this resident because they were fantastic. Please take them as part of your residency.
A great but really interesting point regarding the networking aspect. And I think, in 2020 now, still in 2021, we're still dealing with this pandemic. We're still dealing with this virtual world. Hopefully the conferences will be coming back live this year or next year. But I think a big issue has been the ability to network. So what advice do you have for the graduating class regarding really the virtual networking aspect and their outreach process right now?
So virtual networking is obviously an awkward thing to do because you can't actually interact face to face with a person. I will say, try to sign into as many things as possible. There's so many opportunities out there. There's webinars, there's, virtual meetings and summits and things like that. And the benefit of his honesty is just a good conversation starter. So for example, if I see, Dr. Iorio on a talk and I really want to talk to him, I could reach out to him and say, Dr. Iorio, you gave this wonderful talk. I have a question about X, Y, and Z. Asking a question, showing interest in what someone's doing and what they're passionate about is a really good way to spark conversation and shows that you're actually understanding the topic and interested to learn more. So that's a great way to start a conversation and move across that. I saw med students doing that during their away rotations, and these away rotations are unfortunately all virtual. But I can say that there's actually a lot of interaction with conference, speak up, talk out. Now, you don't want to dominate the conversation and be that person, but you want to be a person who they say, okay, I remember they were interactive, they were listening. Videos on help because you can actually interact with someone, see them, talk to them. That makes a difference. So you can't always participate in it, but that's ideal, the way to do it. And then following up with an email afterwards. And I've had students reach out to me and residents reach out to me to say, hey, can we set up a phone call or a video visit where we can actually talk about this? While we can't meet virtually, the one-on-one aspect becomes much more personal then, as opposed to just a big group setting.
Can you also talk about your involvement with the different national societies?
So it's one of those things where there's a lot of societies and not enough time to participate in all of them. So I've kind of started my society involvement as a resident, and I think we all get involved as AAOS. And here's the thing: even as a resident, even as a medical student, you have to pick and choose where you spend your time. There's just not enough time to do everything. So I've seen patients. I've seen some residents be representatives on the resident committees, and they have the representatives that can apply to different committees, research committee, there's a resident rumble, there's a resident, Senate and things like that. So you can advocate yourself in multiple different areas, but it depends how much you want to be involved. As a resident, I found my passion was in an area called periprosthetic joint infection or infection, total hip and total knee replacements. And there happened to be a society called the Musculoskeletal Infection Society. Who knew? But it was a society, it's a very small society, but the society of individuals who are passionate about this topic. And I found that I was passionate about this topic. So I started to get involved with them as a third-year resident. Now, the first time I went, I was just there to present. And I had a 6-minute presentation. I was so nervous, I did it in 3 minutes. So I probably didn't leave a great impression after that first one. But then I went back the next year, and I went back the next year, and I kept going back. And I just offered them, I was like, what can I do? And so they involved me in there. And then Hip and Knee Society is another one. AAHKS, our American Association of Hip and Knee Surgeons, is our big organization for hip and knee surgeons. And I remember being a fourth-year medical student attending, and they had a resident course, which is great because it's a free course because they pay for your travel to go down, they pay for your hotel, and you learn from the greats of the field. And I offered to the staff, I was like, look, if you have any resident positions, which they hadn't had at the time, I'd be offered to help. And then there was someone who's in charge of the membership committee, and she goes, well, we have no resident who's helping us with the membership committee. Do you want to help? And I said, sure, I'm offered to do that. So whenever you get on these committee, though, make sure that you do a good job of it. Don't just, somewhat show up or don't really do anything, but you really want to take charge and make it your own and then take it to the next level if possible. So once you get involved, be actively involved. Otherwise, don't get involved because otherwise it's not going to be useful for your time.
So as you know, I work with surgeons all across the country. And one thing to talk about when we're dealing with chief residents and fellows is really that transition from resident to attending. And so I'm just curious, what are some key points, some key takeaways that you had from making that transition that you weren't really prepared for or weren't really told about coming out of that situation?
The scariest moment, I think, is, and it's a dumb moment, is when you're in the operating room and we call it the empty wall sign. You turn to the side and you go, what would you do next? And there's no one there because you're the one in charge, not your attending anymore. And for me, that was actually a stupid moment. I was doing a total hip replacement and I put the cup in and the rep asked me appropriately, do you want to put any screws in? Well, some surgeons I worked with used no screws. Some surgeons I used only used 20 millimeter screws. Other surgeons I used only used 25 millimeter screws. Like, what do you want to do? And I froze and I go, I don't know. What do they want to do? Right. So that's a stupid moment, and yet something that was poignant to me because I was like, I got to make the decision. So what I do, I measure the depth and I put in the screw length that I measured. So that I found my own algorithm from that. So transitioning over is know that it's okay to have moments where you're not totally certain, pause and think, and then make a decision. And so that's one thing is like, take things gradually. Don't feel like you have to rush and be the best right off the bat. So that's the key factor. Two, I would say, take your time before you give the reins over to other people. So this is true mostly for academic practice, but when you first show up in a practice, they might say, okay, we're going to give you the junior resident or the intern and say, all right, you got to walk them through the case. Well, the problem if you have a resident is you want to give them the case. You want them to learn. You want them to get hands-on. You want to feel comfortable in your own skin operating before you hand it off to someone else. So when I started off in practice, I had a room when I did my cases, and that worked out really well because I had a first assist with me and I would do the whole case. So I'd feel comfortable operating, but then I would also assist others, or I helped run Dr. Rothman's room, who we worked with a resident. So then I worked with a resident in that scenario. So that was a good balance where I got to feel comfortable in my own skin and then was able to work with residents simultaneously. Not everyone has that opportunity, but that was opportunity that I had that was nice. So feel comfortable in your own skin operating. And then the last thing I would say is don't take on too much. The first thing I think I want to do is sign up for a hospital committee and do this and do that. And you can, 10 things later, you can't even breathe. It's one of those things. So you want to get a little bit busy because your clinic's going to be slow. And then the last thing I would say, which I always say, is be available, right? Be ready to take call, be ready to take a case. When someone says, oh, I can't do this, periprosthetic fracture, can you do it? You say, absolutely. So always say yes, but don't be in above your head, but always say yes.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.